Robotic-assisted hip replacement surgery is a revolutionary tool that leads to pinpoint accuracy, precision of the surgery. This leads to more naturally feeling and functioning joint, leading to very high patient satisfaction and function. Every patient undergoing robotic hip replacement surgery gets a personalized preoperative plan, which involves performing a three-dimensional CT scan of the worn-out hip joint. These CT scan images are uploaded on the robotic software, which then generates a personalized plan for that patient, including component positioning, orientation, and sizing. So even before we start the surgery, the beauty of this process is you can see the patient's new hip even before we have started the operation. The other important component is safety. This operation is really safe because it has inbuilt haptics and stops damaging to the vital structures around the hip joint. And also I can check the function of the hip joint during the operation, and if I need to make minor changes, I can do so. I see robotic-assisted hip replacement has raised the bar of hip replacement surgery, and it improves the patient outcome and function and is a real game changer.